A cesarean section, commonly known as a C-section, is a surgical procedure used to deliver a baby through incisions made in the mother's abdomen and uterus. While vaginal delivery is the most common method of childbirth, C-sections are sometimes necessary for the safety of the mother or baby. Whether planned or unexpected, understanding what to expect before, during, and after a C-section can help ease anxiety and set the stage for a smoother recovery. A C-section might be scheduled ahead of time if there are known medical reasons that make vaginal delivery unsafe. These can include placenta previa, where the placenta covers the cervix, certain maternal infections, or if the baby is in a breech or transverse position. Other times, a C-section becomes necessary during labor due to complications such as fetal distress, stalled labor, or issues with the umbilical cord. Before the surgery, you'll typically meet with your obstetrician to discuss the reasons for the procedure and what will happen during the process. In most cases, you'll be asked not to eat or drink for several hours before the surgery. Upon arriving at the hospital, you'll change into a hospital gown, and the medical team will prepare you for surgery, which includes placing an intravenous line for fluids and medications, and possibly inserting a catheter to keep your bladder empty during the procedure. An anesthesiologist will administer anesthesia, usually a spinal block or an epidural, which numbs the lower half of your body while allowing you to remain awake. In some rare cases, general anesthesia may be used, especially in emergency situations. Once anesthesia has taken effect, the doctor will make a horizontal incision just above the pubic hairline, known as a bikini cut. In some cases, a vertical incision may be necessary, especially if the baby needs to be delivered quickly. After cutting through the skin and underlying layers, the surgeon carefully opens the uterus and delivers the baby. This part of the procedure often takes only a few minutes. You may feel some pressure or tugging, but you should not feel pain. Once the baby is born, the medical team will clear the airway and ensure the baby is breathing well. If both you and your baby are stable, you may get to see and touch your baby briefly before the newborn is taken for further assessment and care. Once the baby is delivered, the doctor will deliver the placenta and begin closing the incisions with sutures or staples. The entire C-section typically takes about 45 minutes to an hour from start to finish. After the surgery, you'll be moved to a recovery area where nurses will monitor your vital signs, bleeding, and pain level. Once the anesthesia begins to wear off, you'll gradually regain feeling in your lower body. It's common to experience shivering, nausea, or grogginess as you recover from the medications. The nurses will monitor you closely for signs of excessive bleeding, infection, or other complications. You'll also be encouraged to begin bonding with your baby as soon as you are able, whether through skin-to-skin contact or breastfeeding. Recovery after a C-section differs from recovery after a vaginal birth. Because it is major abdominal surgery, healing often takes longer and requires special care. Here are some key points to keep in mind as you recover from a C-section. Pain management. It's normal to experience pain or discomfort at the incision site, especially in the first few days. Your doctor may prescribe pain relievers, such as acetaminophen, ibuprofen, or in some cases, stronger medications for short-term use. Use these as directed, and don't hesitate to ask for pain control if you need it. Good pain management is important to help you move around and care for your baby. Wound care. Keep the incision site clean and dry. Your healthcare team will give you instructions on how to care for the wound and when to remove any dressings. Avoid soaking in a bathtub or swimming until your doctor says it's safe. Watch for signs of infection, such as redness, swelling, discharge, or fever. If you notice any of these symptoms, contact your health care provider promptly. Physical activity. Rest is important, but gentle movement can help speed up your recovery and reduce the risk of complications like blood clots. Try to get out of bed and walk a little as soon as you're able, with assistance if needed. Avoid heavy lifting and strenuous activity for several weeks. Most women are advised not to lift anything heavier than their baby during the initial recovery period. Diet and hydration. Eating a healthy, balanced diet and staying well hydrated can support healing. Include plenty of fruits, vegetables, lean proteins, and whole grains in your meals. If you're breastfeeding, you may need extra calories and fluids. Some women experience constipation after surgery, so fiber-rich foods and adequate water intake are especially important. Breastfeeding after a C-section. Breastfeeding can be started soon after a C-section, but it may require some adjustments in positioning due to abdominal discomfort. Side lying or football holds can help reduce pressure on your incision. If you have trouble with breastfeeding, don't hesitate to ask for help from a lactation consultant or nurse. Emotional recovery. Having a C-section can bring up a range of emotions. You might feel relief, disappointment, or even grief if your birth didn't go as planned. It's okay to have mixed feelings. Share your emotions with your partner, friends, or healthcare provider. If you experience ongoing sadness, anxiety, or difficulty bonding with your baby, talk to your doctor, as these can be signs of postpartum depression. Postpartum bleeding. Vaginal bleeding, known as lochia, occurs after both vaginal and C-section births as your body sheds the lining of the uterus. Expect bleeding for several weeks, gradually tapering off. Use only sanitary pads, not tampons, during this time to reduce the risk of infection. Follow-up care. You'll need to see your healthcare provider for a postpartum checkup, usually within 6 weeks of delivery, or sooner if there are complications. At this visit, your doctor will check your incision, discuss your recovery, and answer any questions you may have about resuming exercise, sex, or birth control. There are also some important warning signs to watch for after a C-section. Contact your healthcare provider if you experience severe pain that isn't controlled with medication, redness, swelling, or pus at the incision site, fever over 100.4 38 heavy vaginal bleeding soaking more than 1 pad per hour, foul-smelling vaginal discharge, difficulty breathing, chest pain, or leg swelling. These could be signs of infection, blood clots, or other serious complications that require prompt medical attention. As you recover, remember that healing from a C-section takes time. Most women are able to resume normal activities gradually over 6 to 8 weeks, but everyone's timeline is different. Be gentle with yourself, ask for help when you need it, and focus on caring for both your newborn and your own well-being. In some cases, women may have questions about future pregnancies after a C-section. While many women go on to have healthy pregnancies and births after a C-section, the type of incision, the reason for the C-section, and your overall health will influence whether a future vaginal birth is possible. Talk with your doctor about your options for future deliveries, including the possibility of a vaginal birth after cesarean VBAC if you're interested. C-sections are a safe and common way to deliver babies when medical circumstances require it. With proper aftercare and support, most women recover well from the procedure and go on to enjoy the early days of motherhood. Don't hesitate to reach out to your healthcare team with questions or concerns. They are there to support you every step of the way. Your body has accomplished something incredible, and with time, care, and patience, you'll regain your strength and confidence for the journey ahead.